Hello, good evening, everybody. This is the second webinar organized by OMPEG. This is a webinar organized by Ayurworld in collaboration with OMPEG. I will just give a brief introduction about OMPEG. This is a 4-year-old organization, primarily supporting networking and collaborating amongst the Maharashtrian professionals based in the UK. The long form of OMPEG is Overseas Maharashtrian Professionals and Entrepreneurs Group. We have organized till date around 50 events, including 2 business expo in the UK. This is a subscription-based membership organization. Now this is about OMPEG. Now let's go to Zoom tips. You can switch your Zoom view to a speaker view so that you can see the speaker in full screen when he starts speaking. Whenever you want to have some questions to be asked, you can do it in the chat window and we will capture the questions, and after the presentation is over, we'll be taking the question answer session. At that point in time, you'll be unmuted and you can ask the questions. So during the presentation, everybody will be on mute except the speaker. Let us go and have an introduction to today's session and speakers. We have today with us Dr. Abhijit Shinde, who has a degree in Ayurveda, followed by a post-graduation in Sanhita, that is MD in Sanhita. His specialization is in Nadi Pariksha and Panchakarma. Along with him is Dr. Pragati Shinde, who has a degree in Ayurveda, that is a BAMS, and she has also completed a certificate course in gynecology and obstetrics. They moved to London in 2009 and started their Ayurveda practice. Prior to moving to London, both of them have practiced Ayurveda from 2005 to 2009 in India. Dr. Abhijit also worked as a lecturer in some of the medical colleges whilst in India. In 2009, they started the Ayurveda practice in UK. They specialized in health, beauty, and well-being using Ayurvedic holistic approach, covering various aspects of Ayurvedic treatment. Today, their strength is they have 4 doctors with them and 7 therapists. They are based in Hounslow. And along with the Ayurvedic Therapy Center, they also have started academic courses, providing diploma and certificate courses in Ayurveda. They will be shortly also launching Ayurveda herbal supplements in the UK. They are based very close to London with 2 lovely daughters. So this is the introduction of Dr. Shinde and Pragati Shinde. So I will hand it over to Dr. Shinde now to start their presentation. Thanks.
Thank you very much, Raviji. Thanks a lot for this lovely introduction. And first of all, I would like to thank OMPEG to support us to organize this event. I don't have the words to thank all the core members and Ani and Raviji especially. Hello to everyone and welcome to today's webinar. First of all, thanks to all of you to join today, especially it's the Saturday resting day, and still you are here and listening to us. Well, Raviji has introduced a lot about me already, but I would like to just highlight a few points. Like I'm practicing in UK since 2009, Ayurveda, and we are doing various consultations for the many health conditions, including the musculoskeletal disorders, anxiety and depression, skin conditions, various digestive issues. That's where basically our strength is. And we do the Nadi Pariksha and Panchakarma for all these health elements and the health conditions. Now, since practicing 2009, I have come across a lot of experiences. I have learned a lot. I'm still learning. And that's what we're going to share today. And now, Dr. Pragati.
Hello, guys. Hello, everyone. I'm Dr. Pragati Shinde and his colleague, his better half. So sharing again the screen with him here and trying to help everyone from what we understand about Ayurveda, where it can lead us and how it can kind of be helpful in the current situations. I obviously have more interest in pediatrics, which is the kids, and as Raviji said, it's gynecology and obstetrics, which means like more of the female problems, and during the pregnancies, post pregnancies, or infertility, and all those aspects are usually taken by me. And so let's not make everyone wait. I think we had enough of our introduction. Everybody is getting very curious to get on cracking with the current topic.
Yes.
So let's carry on with it. And I think Abhijit should start.
Yes, thank you, doctor. So see, guys, we thought like it's our responsibility, and it's really, we should come forward and share with you what we have understood the Ayurveda and what actually the community needs here in the UK. In this current situation, we all are locked down. We are suffering a lot physically and mentally, particularly the lot of people who are having the health issues already, like diabetes, like heart condition, like asthma, kids, pregnant ladies, they all are scared. And we thought, being an Ayurvedic practitioner, it's our moral responsibility to come forward and share our thoughts, our understanding with you guys, so that you can get this help. And that's the pure intention, to come forward. So without stretching a lot, let's go forward and start with today's topic, which is the myths, the mysteries, and medicines of Ayurveda, especially with reference to the immunity and this COVID-19 situation. Right. So see, to tackle this COVID-19 situation all over the world, we are doing the two things. One is the external and second is the internal, right? The external thing is we are practicing the social distancing. We are locked down, sitting inside the house. We are wearing the masks. We are wearing the gloves. We are washing the hands. Great job NHS is doing, great job every government is doing all over the world. But most important thing is, while practicing these external protections, most importantly is we should start building our internal protection. And what is that internal protection? How can we build up? Nowadays, we all are talking about the immunity, but what is this immunity actually? You know, what do you mean by immunity? Does the immunity mean simply I'm taking the multivitamin tablet and I am happy? Or does the immunity means I am doing the gym every day and nothing is going to happen to me? Does that mean the immunity? So no, Ayurveda doesn't say this is the immunity, and that is what we want to share with you guys. Before that, most importantly, since practicing, in UK, we have come across a lot of myths. People have misunderstood Ayurveda a lot. So let's just go forward and have a look on some of the myths which Ayurveda basically, which comes across the, along with the Ayurveda. The first myth is like Ayurveda is out of date, or medicines of the Ayurveda are out of date. Everybody says that. How come the 5,000 years old science can still be effective? And how come those herbal medicines will still be effective? Well, pretty simple answer to that is, guys, try and understand Ayurveda is not a purely only medical science. Ayurveda, it is a lifestyle, and medical science is the part of that. And basic principles of Ayurveda, they are based on the nature. Don't forget, we are the part of nature and we live in the nature. So Ayurveda, all these basic principles, they are based on the nature. So till the time nature is going to be there, Ayurveda is going to be there.
And
so,
we are going to be there, obviously.
Obviously. So Ayurveda cannot be out of date. It is because the basic principles of that, they are based on the nature. And I'm going to introduce you with some basic principles in the lecture ahead. Pragati?
So basically, the another myth that we usually come across, many people do ask me, do you have any home remedies? I'm like, yes, there are home remedies, but it is not a science which is just restricted to the home remedies. It has a very broader picture, which we need to understand, that although it's such a long kind of process that we have come through or walked down since past 5,000 years, there's a continuous evolution in the humans, in the technology, and same is with the herbs. So initially we used to have literally crude forms. So, you know, the Ayurvedic Vaidyas, I wouldn't say doctors, but Vaidyas, they actually had their own plantations. They would go and according to whatever patient is there, they will kind of make the decoction or kind of, you know, give them the raw herbs to eat. So we are still pretty much in a better place, that we can, due to technology and everything, we have come and made it so well presented and more sophisticated to the palates of most of you, although I know it's not very easy, but that is the natural way to healing.
Yeah, so it's not only the home remedies. Ayurveda has used and a lot of minerals. Ayurveda has used a lot of metals. Ayurveda has combined a lot of things. I mean, the famous thing which we're going to talk about today is the Chyawanprash. Of course, you guys know about the Chyawanprash. So Chyawanprash itself, the authentic Chyawanprash, is the combination of 52 herbs in that. So it's not the home remedy. So that's another myth. Third one, people do say like Ayurvedic treatments or medicines take time to become effective. Well, unfortunately, what happens is clients or patients, they come to us when the time is already gone. That's
usually,
the fact.
Yeah, they have kind of tried and tested most of the things by the time they have kind of hit us.
Yeah. So
we
any
need to
pathology,
understand that part of
so any pathology or any condition that has already become chronic. So obviously that taking consideration that chronicity, and most importantly, Ayurveda is not a symptomatic treatment, not a symptomatic management. It is a cure we talk about. So we need to try and understand Ayurveda is working onto the basic cause, and that cause to eradicate from the system, that pathology to reverse, it's gonna take time. And that's why Ayurveda does takes the time, but not always.
Because usually understanding how Ayurveda works, that is also pretty important for all of us, because it's not like a symptomatic treatment. We really need to evaluate what exactly are the factors that are causing it, or what exactly needs to be corrected. So it's like a chain in the body, and we need to kind of solve that jigsaw puzzle and then find the missing piece and put it in place and correct it. So it's a whole process of understanding the whole etiology, and not necessarily always we will have a name to put forwards. Like many people ask, okay, so what have you diagnosed, or what would you say this condition is? Because in Ayurveda, we don't go by that. We go mainly by what are the causative factors, what is the samprapti, so what are the pre-symptoms, what are the symptoms, and what actually the picture is. So we have to follow that.
Yeah, so that myth is basically we are covered. Next one is Ayurveda is meant to treat chronic ailments only. Not always. As we discussed, people do come when the condition has become chronic, but Ayurveda does treats the acute conditions very effectively as well. Next one.
Yeah, many a times we do get so many clients in the clinic which do come with muscular spasms, and that is not chronic. They have just got a spasm, and we do get phone calls that they need something to relieve it. So there are things which even acute, like
diarrhea is there. Clients do come with the fever. Clients, they do come with the acute headache. Clients do come with the open wounds and cuts, and Ayurveda can manage it very well. Next myth is Ayurveda don't understand anything about the pandemic. Well, just to share with you guys, Charak Samhita is one of the basic script of the Ayurveda, which is scripted 3,500 years before. And in that, there is a chapter number 14 in Sutrasthan, which called as the Janapada Dhans. Janapada Dhans means basically
itself
all this
epidemic and
pandemic conditions. And there is everything is written down basically about this pandemic conditions. Right, so these pandemic conditions, they have written down causative factors of that, and Jala, Vayu, Desh, and Kal. Jala means basically any infections related with the water. Vayu means any infections related with the air. Desh means if land, it will get basically the problem, that one. And then Kal means basically the different weather conditions or different seasons. So they are chronic than one than the other ones. That means we are struggling here a lot with this droplet infection, which is into this Jala category. And look, the world is onto the hold now. Imagine if the Vayu will get contaminated. That means air will get contaminated. Imagine if the land will get contaminated, from which all these crops and fruits and everything is growing. What's going to happen? So there is a specific reference to that. Next one is Ayurveda cannot treat bacterial or viral infections. Well, that's not the fact, because Ayurveda has specifically mentioned two things, Krumi and the Bhut. Now, Krumi means what? Krumi means basically all the pathogens, which are like all the bacterial infections and all the viral infections can be covered under that. And the Bhut don't go the word to word meaning of the bhoot in Sanskrit. Bhoot sometimes people do think as
We don't mean ghosts,
a
but
ghost. Bhoot is something which is like the pathogens which cannot be seen with the naked eyes, and Ayurveda treats that fantastically. I mean, no doubt about that. Ayurveda don't understand the new health conditions. Well, not always we need to know the name of the condition. We need to try and understand the pathology of every health condition. And once we understand the pathology, it is treatable. So even the COVID-19 situation can be treatable. Of course, a lot of support needs to be done. A lot of research needs to be done on that. And we're going to discuss about that in the furthermore slides. And the last one I will cover, there are no side effects of Ayurvedic medicines. In fact, that is not true. There can be the side effects of the Ayurvedic medicines if the medicines can be taken into the wrong way. So guys, these are some common myths which we did covered. And we have tried to answer that. There are so many other misunderstandings as well, but we would like to just go forward with our most important thing about what is immunity. So talking about the immunity, Ayurveda says immunity means oja. Now this is one of the Sanskrit word, oja. What does that oja means? Oja means essence of something. Essence of what? Essence of the 7 basic dhatu in our body. All right, so I'm gonna explain to you what does that mean, dhatu, what does that mean, all these words one by one. So first of all, oja means essence, dhatu means 7 basic tissues in our body, or you can say the 7 basic channels in our body, and the essence of that is called as the oja, and that oja is the immunity actually. These are the word to word meanings. Okay, now this immunity is of 2 types. From where the immunity starts? Immunity starts right from the actually fertilization of the ovum and of the sperm. So that is called as the para. That is the first. That means before even you are born, during the gestational period, your immunity starts boosting up depending on the diet of the mom, depending on the diet of the of both of them. Now we cannot talk about that, and we should not talk about that because that is gone. That time is gone. But apara means basically after that, depending on our diet, depending on our lifestyle, and depending on so many factors, we can develop our immunity. So you guys will say, okay, now I will start eating, as I discussed, as I said, like, I'll start building up, like taking multivitamins or vitamin C, and I will start boosting up the immunity. Well, unfortunately, immunity cannot be boosted straight away like that. It will help to you, but there are so many factors before that we need to try and understand. Which factors? Let's have a look. First of all, as I mentioned, we are the part of nature. Don't forget, this is the mystery of Ayurveda. We are not different from nature. Now, being a part of nature, we have the same elements as they are present into the nature. What are those 5 basic elements? As you can see onto the screen: air, fire, water, earth, and ether, or you can say that as the space. Yeah. These are the 5 basic elements. Now, what is the significance of those 5 basic elements? I mean, why we should understand that now in terms of understanding the immunity? This is because when we talk about the immunity, we need to try and understand everything is having the 5 basic elements. Everything is having the 5 basic elements. So as our diet, it is having the 5 basic elements. Our every tissue, our every cell of the body, our every organ of the body is having the 5 basic elements. And the permissible combination of those 5 basic elements forms 3 doshas. 3 doshas means what? 3 physiological factors in our body. And these 3 physiological factors, many of you might know about it. That is called as the vata, the pitta, and the kapha. What is vata? What do you mean by vata? Vata means simply air in our body. What do you mean by pitta? Pitta means fire in our body. What do you mean by kapha? Kapha means water and earth combination in our body. Okay, now I will simplify this to you. Vata means not the air which you understand, which is like bloating and which is present into the digestive system. That is one part of the vata. Vata is responsible for many things. Vata is responsible for every movement of our body. Vata is responsible, and it is mainly dominated below the navel actually. Pitta is the fire element which is responsible for all the metabolic activities. and that is dominant between our navel and in our chest area. And the kapha, which is dominated in our part, I mean, above the chest and the in the lungs. So that's where the kapha is mostly dominated. So they have particular functions to do. They have particular pathologies to perform, this vata, pitta and kapha. Now, what happens, imagine we are talking about the COVID-19. What is happening there? Some virus is going inside where? A respiratory system, which is a location of what? Which is a location predominantly of the kapha. That means water and earth. Now forget about for a time being about the vata and pitta. Let's focus on water and earth, the kapha. So this is the kapha location. And what is happening is kapha will start aggravating, right? Because it's dominant over there. Lungs, our lungs, they are inhaling what? Inhaling the air. That means inhaling the vata and exhaling the air. Now what happens is, just because of the accumulation of this kapha, the obstruction starts coming to the air. So you cannot inhale the oxygen, you cannot exhale the carbon dioxide. Why is that happening? Because the air is getting obstructed with the kapha, the water. Water is going there where it should not be. If the water is going in your legs, what you find? You find the inflammation and you say something has gone wrong. So this kapha is having its specific location, vata is having its specific location, pitta is having its specific location and specific things to perform inside their own homes. But if one starts going in other home, there can be the problem, and that is what is happening over here actually. So we need to focus, how can we not produce this kapha inside the body, and how can we not allow this kapha to get accumulated in the chest and in the lungs, right? So let's go forward and try and understand 7 dhatus in depth now. This is most important slide of the today's webinar. Guys, feel free to take the picture of this slide. Feel free to understand in more depth after the webinar as well. So what happens is, as you can see, I will use my cursor. You can see the vata stands for V, pitta stands for P, kapha stands for K there. And you can see a circle has been shown there with the names Rasa, Rakta, Mans, Meda, Asti, Majja and Shukra. These are the Sanskrit names. I will simplify to you. So whatever we do eat, the food needs to get digested. After the digestion, the essence of that, the nutrition of that needs to get circulated through the rasa. What is the rasa? Rasa is all the bodily fluids, all the electrolytes, right? Sodium and chloride and potassium and all those electrolytes means rasa actually. Rakta means blood. Mamsa means muscles. Meda means fat. Asti means our bony channel or skeletal. Majja means our nervous system or entire nervous channel. And Shukra means our reproductive channel or reproductive tissue. Now, the most important thing I want to share with you about the immunity is how you can boost up your immunity. The key is here. So listen carefully. Imagine if you are not feeling hungry and you have taken any very nutritive food, very nutritive food, like a
Chyawanprash, for example,
Chyawanprash,
which actually is an immune booster.
Yes. What's going to happen is your digestive system is not going to digest that at all. What's going to happen? A byproduct is going to come just because of the indigestion, and that byproduct is nothing but the ama that we call as the ama. What is this ama? That ama is a sticky mucousy substance actually, and that sticky mucousy substance, which is a byproduct of indigestion, that's going to start circulating in these channels, right? Now I would like to come back to the point about the respiratory system. That's what we are all worrying. Kapha is accumulating into the lungs, but my question is, where this kapha is getting produced actually? Exactly. Where is the production? Where is the factory of that? So factory is here, guys. Factory is in your digestive system. So you need to keep your digestive system healthy if you want to keep your respiratory system healthy. So key is there. Keep observing your appetite. Keep observing your agni. Eat when you are hungry. Don't eat if you are not hungry. It doesn't matter sometimes what you are eating, but it does matter always when you are eating. If you eat, if you are not hungry, you are creating the ama, you are reducing the immunity of your body. So here is the key of the immunity. Most important.
Yeah. It's just a simple question to many of you who are listening. Half of the time, we get so engrossed in our daily schedules where, we just say like, yeah, although it's lunchtime, I might just finish what I'm doing and then I'll grab my lunch. And we go a bit overboard the time. So it's not always that you are not hungry, but sometimes even if you kind of, go overboard the time of your appetite, even that does matter here. So
yeah, I will give you some clinical, basically simple examples of this concept and how beautifully it comes into our clinical practice as well. Many of you know rheumatism, rheumatoid arthritis. What does happens there? Exactly same thing. Go back to the slide. So AMA, that sticky mucous substance, that starts accumulating in the system and it starts circulating. But when that comes into this channel, Asti channel, then it starts
basically gets stuck.
Yes, it gets stuck there and it starts accumulating into the joints. So the client comes with, oh, I have got the joint inflammation and pain, but it's nothing. It's actually the AMA, it's there. So if you start reducing the AMA into the digestive system, within 2 to 3 days, the rheumatic aches, pains and inflammation gets reduced. So it is like that. So imagine if this AMA is going in your respiratory system, you will suffer. So we need to keep our internal system ready so that this COVID-19 pathogen, I will give you another example. For everything, for every pathogen to establish into the body and to carry forward the pathology, it needs certain conditions, favorable conditions. And if our body will provide that favorable conditions, like imagine conception, according to the Ayurveda,
classic example.
So according to the Ayurveda, there for the conception, 4 things are very important. What is that? Rutu means favorable time is very important.
Which we call as the ovulation time, which is the fertile time.
Yes. Kshetra means basically the uterus has to be very, very healthy. That's the second one. Third one is Ambu means all the nutrition from the mom and dad has to be very well. And then last one is the Bij. That means the sperm and the ovum, which has to be very healthy. Why I'm taking that example?
Because the sperm and the ovum is quite at the last. If you try to understand what comes, the basic first 3 things are so important to understand this concept that doesn't matter. Even if it's, recreating your own offspring or giving a favorable condition to a virus like this. Because if the virus doesn't get any favorable conditions in your body, it is not going to thrive. Exactly.
So same thing applies over here. If the virus is there, which is the Bij, imagine, Rutu, we don't have the control over the Rutu because generally in this springtime, everyone's kapha is increased naturally into the body. This is the nature's effect of us, just because again the basic principle is we are part of the nature. We cannot trick the nature. Okay, so Rutu we cannot have the control. Kshetra, which is our body, so we have the control over that. Ambu, that means the good nourishment. And then last is if the attack is happening to you, if you are getting in contact with any person and by any chance if you get attacked, if you can keep your Kshetra and Ambu very well, you don't need to worry about. So that's what it is. So, this is very important concept and this is very important to understand how every disease manifests into the body, how every pathogen manifests into the body, every bacteria and every hay fever is the best example I can give it to you. See what happens into the hay fever in this spring conditions. A lot of clients, they do come.
We have, in the clinic during this time, we have a big boom of hay fever basically.
So Staphylococcus aureus, we all know that is the basically pathogen which lives into the nostril. What happens is as soon as that gets the favorable Rutu, that means the favorable season. It gets the favorable Kshetra, that means the favorable respiratory system to flare up. It flares up in those people and then it starts with the hay fever. So we have the clients coming every year, they suffer with the hay fever. Why is that? Because they haven't cleared it, right? So that Staphylococcus that needs to basically, clean. The body needs the detox, and then every pathogen, even if it comes in your contact, you can fight it very easily. I hope, guys, I don't want to be very technical in all this. I mean, you have understood what the message we wanted to convey to you. Now let's go forward and have a look on this. Please feel free to take the picture of this slide as well. This is most important slide. What the message we want to give you through this slide is our diet. Actually, we should not look into our diet in the form of how much carbs I'm eating, how much protein I'm eating, and how much basically minerals I'm eating, and like that. That is fine. That is one of the way of looking in our diet, right? At the end of the day, what we're gonna eat, we're gonna be like that. If I drink alcohol, I'm gonna be like the alcohol. If I drink milk, I'm gonna be like milk. As simple as that. So if I eat the diet according to the Ayurveda, which says our every meal should have 6 tastes or shad ras, that's what we call, like madhur, amla, lavan, katu, tikta, kashaya. I mean, we have simplified this on this slide. I don't want to go one to one, but take
a bit too technical for you guys to understand. But that's what we call as sattvic ahar basically.
Yes. So the diet is very important in boosting up the immunity. If you keep these 6 tastes, all the 6 tastes in your diet, in your food, on your plate, every time, every meal, I am saying, and in all the ages, that's gonna definitely boost up your immunity like anything, and that's gonna make your food digest like anything. It's like that. Eating only sweet is not gonna help, or eating a lot of spicy. Some people eat a lot of spicy. That's not gonna be helpful. So ultimately, in a nutshell, how our diet should look like, how our plate should look like, and how we eat nowadays. If you can see,
rather than say how we eat, what we like to eat.
Yes.
Let's put it that way. I don't blame anyone. Even my kids would, if I give these 2 plates, they would be very happy to see the second plate.
Yeah, but yeah, we should try and keep our plate like this, which is on our left side of the screen. The reason behind that is this shadras, the 6 tastes should be there in our diet, so that this 6 tastes, what they're gonna do, they're gonna first of all digest very well, provide the right nutrition through the channels as we discussed. Second important thing, vata, pitta, and kapha, the 3 doshas, they are getting the equal nourishment and they are remaining in the balance. That is very important.
Yes.
So that is what the key to immunity is, so that's how you can just boost up the immunity. Let's go forward and let's have a look on some of the classical herbs actually. So Pragati.
So let's start with amla, I think, which is most favorite, and everybody knows most of the things about it, but there are various aspects about different herbs. So the first very important thing about amla, that why it is the first drug of choice, or why it is the first herb of choice for us when we talk about immunity, because particularly this herb has 5 rasas except the salt, which you can very easily just put a pinch of salt on it and have to make it a shadrasatmak ahar.
6 tastes at the same time.
Exactly. And this is not just, if you look, that it boosts up the immunity, but we call it as even a rasayan. And when we call it as a rasayan, it can not restrict any age. It is not restricted for any pathology, any disease. So basically anyone of any age with any ongoing pathologies can have it. So this is the beauty of amla. At the same time, if you see and look at its nutritive things, or its chemical composition, how it works, and because it's a rasayan, it actually improves the longevity or your life. At the same time, as it is a rasayan, it nourishes all of your dhatus. So imagine, it's not working just on one thing. So it is completing the whole cycle, which is so important that you don't have to, think, okay, I've done for rasa something, now I have to work on rakta, I have to work on this different. So in a nutshell, it provides nutrition to the whole circle. Plus, it is so good for digestive system as well, as we're constantly talking about the digestive system, because we are emphasizing so much on it, because that is the main key to understand that whatever you do first hits into your tummy, then it goes everywhere else into the body.
Yeah.
So
Yeah, talking about the amla, I mean, I'll give a simple example. Amla can be very nicely used by the diabetic people as well.
Exactly.
Amla easily available everywhere. You know, you can buy it and you can preserve it, and mix the turmeric. Everybody is having in the kitchen, so mix the equal quantity of that. And diabetic people, they should start taking that first thing in the morning, like half a teaspoon of amla, half a teaspoon of basically turmeric, or like half piece of the amla and half a teaspoon of turmeric. And believe me, that's gonna reduce your blood sugar levels very nicely
And
now
naturally.
and naturally. And reducing the blood sugar level does not mean like everything is done into the diabetes. We will talk about that
In the next slides.
Yeah. Next herb we have chosen is the haritaki. I would like to explain to you about that. It is again the same thing. It is having the 5 tastes. We are emphasizing on eating the 6 tastes at the same time to boost up the immunity. It is not having the leaven, so you can add a little bit of the leaven into that and start eating that to make it the shadrasatmak, so that you have the lot, shadras at the same time just by eating simple one thing. As you can see onto the slide, you know, haritaki basically it's a rasayan, as Dr. Pragati has explained to you. That means nutritive to all the dhatus. Haritaki we have used a lot as a mild laxative. Haritaki we do use onto the inflammation, cleansing of the wounds. Haritaki we have used basically to provide the nourishment to the optic nerve. We have a lot of clients coming in the Ayurworld for actually macular degeneration.
That is quite popularly we get.
Yeah, so macular degeneration, we have treated many patients simply using the haritaki. Tremendous results we have got with this simple haritaki. And you can buy this in UK, you know, in Asian superstores. Easily it is available. Guduchi is the next herb, Tinospora cordifolia. That's the Latin name of that. And nowadays a lot of people are consuming it. The reason behind that is there is nothing like guduchi if you want to boost up your immunity particularly. The reason behind that is guduchi is having the tikta katu and kashaya. Now again, little bit technical. This is the rasa, but vipak of that is the madur. Madur means most nutritive. So it gets absorbed very nicely and easily into our system, particularly in those 7 dhatus. And guduchi is fantastic, immunity booster. Guduchi we have used in our practice for the lot of clients who come for the fever actually. I have used particularly for the liver enzymes. I mean the clients who have the alcoholic background and their liver enzymes has been increased, and we want to reduce this SGOT, SGPT levels. I have used a lot. Guduchi I have used into the gout patients, into the rheumatoid
it works
patients.
Fantastic in
Gout and rheumatism, I have used a lot into the diabetes patients as well. So these 3 just as typical herbs we wanted to just share with you. And now we will come to the most important thing, is what you can do at home now, guys. Okay, so this is the thing which you can start doing at home. Nasya is the first thing I would like to recommend to you. What do you mean by nasya? Nasya means basically nasal insufflation or nasal administration of different things. In Ayurveda, this is the part of the Panchakarma, 5 different ways with which we can detoxify our body. Why I'm recommending you nasya? Because today we are talking about particularly the respiratory system. Nasahi Shirso Dwaram, that is the Ayurvedic principle. That means nose is the door to our central nervous system, and also it is basically the door for our respiratory system as well. So if you start simply administering, as the slide says, the ghee, the clarified butter, 4 drops in each nostril, or the sesame oil, 2 drops, or the specifically talking badam rogan tel or the anu oil, 2 drops in each nostril, that's gonna help. How that's gonna help? We are using oil here, right? So oil basically oilates our internal cavities and the tract and the larynx area. So sticky mucousy kapha, that mucus that cannot stay there and that can come out very quickly, so that accumulation won't be possible. So oilation is the first key, and you can start doing that at home. Don't get hesitated and don't get scared like there will be some problem. It's all the phobia about it. Simple ghee, 4 drops in each nostril will do the job, or plain sesame oil, make it warm and start putting that into the nostril. That will do the job. This you can do at home. Next thing you can do at home simply is the gandush, gargling. many of you know, like the warm water gargling or the salt and water gargling. That's going to help you. Why we are recommending you the gargling? This is the part of the dinacharya of Ayurveda. Ayurveda says every single day we should be doing the nasya. Every single day we should be doing the gargling. Again, gargling is gonna reduce the mucus, the kapha, the bad ama from that area, and it's not going to allow the pathogen to regrow there. It's not going to allow the pathogen to go further down into the respiratory system. So if you start feeling the little bit irritation into the throat or tingling sensation into the throat, immediately start gargling with what? Simply with the warm water and salt and turmeric. If not turmeric, just the warm water and salt. If you have triphala powder, many of the people do have usually in their home, you can boil that into the water and start using that in the form of gargling. My 9 years old and 6 years old, we have taught them already to do the gargling, and they are practicing everyday gargling.
It's just a fun trick for them, basically, because of the sound.
Yes, it's like make it a fun, make it a like a, like a family practice kind of the thing. You can use the warm sesame oil or specifically irimedadi oil that is very, which is available in Ayurworld clinic, or vinegar you can use as well. So that gargling is going to help. That's the second thing you can do at home. Third thing is the dhumpan. What is the dhumpan? Dhumpan means basically inhalation of the fumes, the medicated fumes. Okay, now not necessarily it has to be medicated. Even if you just boil the water and take the simple steam,
that is also a type of, not dhumpan, but it does help to kind of cleanse the nasal pathogens, and it cleans up the mucus as well from the nasal cavities, and it drains it. So that's what about we are talking.
Yeah, so the mucus basically gives the platform for the bacteria, for the virus to grow, and we need to reduce that. And this dhumpan trick, it does works. If you want to make it very effective and very well, you must be having these things at home. Turmeric you must be having, mustard oil you must be having, white cotton cloth you must be having, and black pepper powder you must be having. What you need to do, take the cotton cloth, soak that into the mustard oil, add the turmeric on that, add the black pepper powder on that, and make a small roll of it, and literally burn that cloth. And whatever the fumes will come, as you can see into this picture, you can make a one small cylinder kind of the shape with anything, and then start inhaling by closing one nostril, deep inhalation and exhalation from the mouth. This is very important. So inhale from the nostril and exhale from the mouth, so that you are clearing all that passage actually. And then use the another nostril, inhale from the nostril and exhale from the mouth. This thing can be easily done at home. Be little bit careful way if you want to do that for the kids, but adults can do that very effectively and easily. Next, time to time, you should be detoxifying your body actually. These are the 5 different ways with which the body can be detoxified. This of course cannot be done at home. You need to see any Ayurvedic practitioners, and under their guidance only we can detoxify the body. So if you see Vaman, that means the emesis, scientific emesis, which is the most important thing for the current situation, which is the kapha. Kapha can be nicely taken out of the body with the scientific vomiting actually. Basti means colonic therapy, that is very, very useful for the vata dosha. Virechana, basically, that is very much useful for the pitta. Nasya, we have discussed the small type of the nasya, which is very effective for the respiratory system and which is very effective for the brain and related concerns. And Rakta Mokshana, that means the bloodletting. Simply, if you donate the blood, that is the natural detoxification of your body. And there are the different ways of bloodletting. Like we do typically use the leech therapy for number of skin conditions and eczema and kind of the thing. So if time to time, if you keep detoxifying your body, you are boosting up your immunity, because what you are doing is you are detox, you are taking the toxins out and you are regenerating the tissues, you are allowing the tissues to regenerate. So you are boosting up the immunity. Pragati?
So yeah, I guess he has passed on this one because it's all, my part of interest, all the kitchen work, basically getting it all ready. So the home remedies. So let's start with the very basic one, which is milk with the turmeric. turmeric is something quite, again, like a rasayana. You can take it very regularly on a daily basis, but especially when we are talking about working on the mucus alongside, boosting up your immunity and nourishment. So this in itself is like a complete package for all the three. I would like to explain it, like how do you take it, because many people don't understand. They just think like, okay, just take a glass of milk, put some turmeric and drink it. No, it's not as simple as that. So I would like to highlight it. You just have to take half a cup of water, half a cup of milk, and you kind of, while you're boiling it, you add the turmeric to it. But make sure you add the turmeric before it starts to boil. Otherwise the milk is going to get curdled, which we don't want. So that is again very important. Then let's come down to the second one, which is very simple. There's no specific procedure to follow. You can just kind of take it, blend it and have it. And similar is the third one. But to understand what these things do is they try and help, because what ginger does, I know there's a big boom everywhere, WhatsApp, YouTube, everywhere that have ginger. Why do you have ginger? It's not just to get rid of the mucus, but as Abhijit is highlighting so much on the ama and the agni, it works on those factors as well. So basically ginger helps in getting the right agni deepen. At the same time, it works even on the ama, which is in your stomach, to get rid of it. It kind of digests, breaks it down, breaks the strands of the ama, which is in normal terms, we call it as toxins, to make it simple for you guys to understand.
I would like to add one point there. Like I'm repeatedly talking about this ama. I will give you some hints how to identify, first of all, if you have the ama or not. Do one thing, wake up first thing in the morning, go in front of your mirror, and before brushing your teeth, observe your tongue. Guys, if you have the white coating on your tongue, that means you definitely have the ama in your system. All right. So that's the simple test. So if you have the ama, you need to start doing this. So ginger and honey works. Hot water is very, very important. Keep drinking always the hot water and the warm water. Don't drink the cold water at all. Hot water is very important, not only because of the temperature difference, but how hot water has been considered as vishagna. That means if you drink the hot water, even the poison can get nullified. And if you drink the cold water, the poison can flare up more. So that much, hot water is important. Adding the lavang, that means the clove, to the hot water gives the additional benefit into the hot water. Adding the gold. Now this is very interesting. You know what the gold, I mean, gold means literally I'm talking about the gold which we do wear. But make sure the gold which you need to use here is unused.
It's a brand new. You haven't kind of worn it or nothing like that. So you just have to get it from the goldsmith, keep it nice and clean, take a pot of water, put that gold coin or whatever it is, ring, put it in that and let it boil good for 20 minutes. So the essence, you wouldn't see actually gold coming out, or it doesn't kind of melt in it, or it doesn't kind of get dissolved in it. You can still see the gold intact, but the essence of the gold comes into the water. So again, this is one of the Rasayan Chikitsa, which I have done it for my girls. So
that you can do, adding to the boiled water. Lemonade and buttermilk, we all know that rehydration is very important.
But once again, lemonade and buttermilk, they are two different things. Yeah, don't mix it up. Yes.
So like accordingly, you should be using that for the rehydration. Long pepper is one of the easily available thing into the market, and if you start taking the long pepper along with the jaggery and along with the sesame oil, that's gonna help a lot actually. Long pepper particularly, you can practice doing that, particularly to those people who are already having some history like asthma, like
COPD,
like chronic obstructive pulmonary disorders. They should definitely use the long pepper. Long pepper helps a lot into the respiratory system. Next one, Pragati.
Sometimes I'll just go over the long pepper again, because there's one more remedy of it, which probably sometimes some people can't take a lot spicy, because when you have to take the pepper directly with jaggery and sesame oil, sometimes some people can't take it. So there's another way of doing it, where you boil a few of the peppers in again half a quantity of milk and half a quantity of water. So again, the essence comes into it, and you don't have to actually take the pepper. You just have to drink the decoction that is being reformed after boiling it. And that does the similar trick and same effects you get once you do that.
Talking about again long pepper, just to share with you, tubercular cough, the people who have the actually tuberculosis, active tuberculosis I'm saying, and if they are coughing, we have used in our clinic simply this long pepper, and it has done the job what it should do.
It really works wonders.
Yeah. So it is that effective. Dated soaks, dates soaked in the ghee actually, that's very effective. So you have the dates available, you have the ghee available, just soak the dates in the ghee, start eating that. Badam, we all know that about the almonds.
Yeah, almonds, I think everybody knows, because this is quite a popularly practiced trick. Yeah. Almost every household does that. They soak the almonds overnight. Just a few almonds, soak them overnight, peel it, and have it next day morning.
Yeah, so that is very important. Kharjur month. Now I will explain to you just quickly. Kharjur means nothing but again, take the dates, add the hot water in that, mash it and leave it till that cools down. And once that cools down, basically strain it, and then whatever is remaining there, that you should be having. And then the water, don't throw it, but drink it. That is immunity booster as well. Peya of the moong dal and the rice, that is nothing but different soups.
Exactly. So it's very easy, but when we say that it's rice or dal, many people say, how do you soup it? It's not that easy. It takes a long time to cook. But the simple thing, if you just take a little bit of ghee, I know many people, when I say ghee, they're like, oh, cholesterol, or how come that's healthy? But apparently it is quite healthy, because if you look into it, it is the essence of all the dairy products, is the end product basically of all the dairy. And it is pretty much, if you use it in the right quantity, it is the best lubricant to the systems. So far we haven't spoken about the lubrication, but I would like to highlight, because whenever you go through any infections, your body does get dehydrated. And that is why in our home remedies, what we are emphasizing more on is the fluidy part, the liquids, rather than any of the solids. It's not like you don't have any solids, like solid food items, which cannot be a part of a healthy thing, but we are emphasizing more on these, because if you practice these more, it's going to be more beneficial in the context of rehydration, immune boosting, agni, like your appetite. So that's why we are highlighting more on that. And that is why you can see ghee in many of the items. So when you're doing the peya, you just have to take a little amount of ghee and roast your whichever dal or whichever rice or wheat, whichever whole grain basically you want to use. You just take a tiny bit, so just a tablespoon of that grain, and you just toast it or roast it till it's slightly, you can smell the essence and you don't burn it. You let it cool down, just grind it halfway through, and then you cook it. And then the soup that becomes, it's very much lighter than actually the grain when you eat. So that's what we call it as peya. Now the next one is the ragi mud, which usually we call it as nathani sattva. So it is, again, you just take a very little amount of ghee, a very small amount of the flour of ragi, and slightly roast it. Then gradually add some water and milk to it to bring it to the consistency where you can drink it. Many people like to have it a bit sweet, so you can add a bit of jaggery rather than the sugar. That's what I would recommend. And if you guys like cinnamon, go for it. Nothing good than that.
Yeah, that's true. So see, basically guys, we are talking exactly opposite to what is happening now. Nowadays, since the lockdown is there, all the Facebook pages and WhatsApp is full of the recipes. I cooked this, I cooked that. And what the people are cooking is all the heavy to digest the food. Whereas, please don't do that. I mean, do cook the new recipes, but do cook what we are recommending to you, which are helpful for the Agni Vardhan and not producing the ama. Because if you're going to eat the heavily digesting food and sending the pictures on the Facebook and WhatsApp, well, everyone is going to produce the ama, and that is not helping for the current situation. So do use the ragi malt, do the peya, these soups and these things. Going to the next one, gooseberry.
Yeah, I would like to interrupt just 1 minute. It's not about just the heavy food. You can have the heavy food if you're having that amount of exercise to break it down, because in today's condition, we are all so stagnant that I myself, now I know many people are going to say that, come on, you can't say that, but I actually feel sluggish. Because you know what, you are just moving indoors. You're not kind of going out that much, or you're not mobile. So doesn't matter how much efforts we take to do the yoga or the exercise or everything, it is still not enough for the metabolism to break down a big meal, and that too at least 2 times. Forget about the breakfast. We might, I'm just saying might, but sometimes we have all the 3 meals so heavy that at the end of the day, sometimes we don't even feel hungry at all.
Right. So this next 2 I will quickly cover, because we need to cover a few more things. So gooseberry cardamom, that can be made into the juice and take along with the honey. And licorice powder, everybody does have that, or it is easily available, can be taken along with the honey or with the hot milk. Now, for those guys who are into the vulnerable categories, you know, someone is having the diabetes, and now how they should cope up, because diabetes is very common into the, particularly into the Indian community, and the Asian community. But don't worry guys, see, you are into the vulnerable category because the kapha is more already in you. Meda, that means fat, possibly is more in already in your condition. But don't worry, try and understand the key here. As I have given you the key of the immunity, what the key? Agni and the ama. Don't forget about that. And diabetic, who is worrying about the diabetes, don't forget, most important thing, I said that metabolism and the clade is the key. What do you mean by the clade? Clade is the very similar to this ama, right? What it is, when we talk about the diabetes, our entire focus is my blood sugar level. Well, blood sugar level is the management.
It's just an indication.
It is not the cure. If you want to really work onto the diabetes, you should try and understand you need to reduce this kleda, and kleda is the brother of the ama. Got it? So you need to again go back to the basics of the Agni and Ama, and that's Saptadhatu, which I did mention, and try and work. I have given you the home remedy already, which is there onto the slide. Best home remedy is turmeric and amla powder,
which we have even spoken previously.
Bitter gourd juice, basically Karela juice, that does the fantastic trick actually.
If your palate is not sophisticated for the juice, you can always kind of cook it in a vegetable form and have it on a regular basis. That helps as well too.
Yeah, so Shilajit Rasayan, Ayaskruti, Lodra, so these are some classical Ayurvedic combinations
which we usually recommend after we do the consultations. The only reason, because some people, as we said, that you don't go in that conception of, no, they don't have side effects. Everything that has an effect will have a side effect. We cannot forget about that.
Yeah, so it's like that. So don't worry, amla and turmeric is the key for you. 2 meals a day. I will emphasize a lot for this onto the diabetic people. Well, I am talking exactly other way around, because your physicians, your doctors, they must be telling you are diabetic and you should eat frequently. Problem is there according to the Ayurveda. You should eat when you feel hungry. You should not eat when you are not feeling hungry actually. That is the key there. All right, 2 meals a day does the trick to control the blood sugar levels very nicely. And as I'm saying, my parameter, Ayurvedic parameter, is not to control the blood sugar levels. It is to reduce the kleda. And if you want to reduce the kleda, basically 2 meals a day has to be there.
And regular exercise, of course.
Yeah. So this is for the people who are along with the diabetic. I would like to highlight the people who are having the history or the family history of the asthma. Asthma and eczema goes hand in hand, by the way. So if you have the eczema, you need to make it sure you can get the asthma as well. And they work vice versa, just to share with you. And that is our clinical experience. So again, the asthma, if you have the asthma, don't worry at all. Okay, you are into the vulnerable category, we understand, but the key factor for the asthma is using the pippali, which I did mention, which is easily available, and start using the pippali along with the honey and the sesame oil, or the pippali along with the jaggery and the sesame oil. But really, if you are into the attack of the asthma, like you are breathless, what can you do? Simply take the sesame oil, warm it up, add the salt in that, start rubbing that on your chest, start rubbing that on your upper back, and put the hot water bottle there. This is going to help you in the acute attack of the asthma for sure.
And it has helped quite a lot of our clients so far, because this is not just we are telling for the sake of saying. It has been tested and proven.
Yes. Also, you can take the same sesame oil as the slide says, 2 teaspoons along with the half a cup of warm water, and drink that sesame oil. Because what is happening in asthma, the vata has gone out of control, like imbalance. Too much dryness is there. And the oil, if you drink, that's going to help you in that acute attack. Or you can drink any other oils. If you have specifically these 2 oils by any chance, Mahanarayan oil or Chandan Bala Lakshadi, that gives the more effect. But if you don't have, don't worry, use the sesame oil. And asthma patients, I will highly recommend them to keep these names, Kankasav, Talisadi Churna, take the snapshot and keep these herbs along with you. So in the attack condition, if you are breathless, use these 2 things, Kankasav and Talisadi Churna, and into basically the maintenance phase, use these herbs. So dose of that, how to take it depends person to person. They need to come and consult us and we can guide them. But I have given some basically simple home remedies, and keep this like medicines in your cupboard.
Again, in asthma, if you do the turmeric milk or if you do the ginger and honey, they do work fantastic as well.
Yeah.
Because that is something which you can, if just in case, if you don't have these things handy at home, you can always start with the home remedies and always get in touch with us, and then we can arrange for the herbs and everything.
Yeah. So going forward, again, there are few other things which are covered into the asthma. Chyawanprash is there, which we have talked about, which is the best thing to boost up the immunity, particularly for the asthma people. Rasayan Chikitsa for respiratory system, we have talked about that. Avoid eating late in the evening, which is very important. Eat very light food, because again, the ama should not get produced.
Especially at night.
Yeah. Eat garlic and ginger in every meal, which is very important. Drink always warm water. Hingwashtak Churna and Karpuradi Churna, Sanjivani Guti. So these are the, again, few specific herbs.
Herbal combinations, basically.
So you can use this, you can take a snapshot and you can use this in the given doses. Most importantly, avoid yogurt, don't eat fish, and don't eat fermented food. Very important note. Don't eat yogurt. We think yogurt is cooling to me. Yogurt is very, gives me the cooling effect.
Apparently, it is healthy. Yes, it is healthy. But especially for the vulnerable people, we would recommend you to avoid these things, because these things create a very favorable condition for all kind of viruses and bacteria, because it encourages the growth of mucus.
Yeah.
So that is the concept behind it.
Yeah, and here we go. We have come to the last basically slide and some last explanations and some final tips to you guys. As we have discussed, eat light food, don't eat heavy food. You have understood by the time what is light food and what is the heavy food. Eat according to your agni, that means according to your appetite. Rest well. Sleep is the only basically time when you can regenerate your tissues. So resting well is very important. Now a lot of clients ask me, how many hours shall I sleep? Well, that's not important.
That can't be explained, because every person is very different. And resting doesn't mean just lying down in bed. Actually, whatever hours of sleep you get, that should be like a peaceful, deep sleep. Then it does not matter. You sleep for 6 hours, you sleep for 8 hours, because irrespective, sometimes many people will say, doesn't matter, we sleep for 8 hours, but still we feel groggy when we wake up. So to understand, resting well means getting that peaceful rest. The sleep shouldn't be interrupted, or it shouldn't be once it's broken, not able to fall asleep, or tossing and turning for a long time before you sleep. All these things come under that.
Yeah, so that's very important. Diet and lifestyle needs to change according to weathery conditions. Well, we do change the clothes, but we don't change our diet into the weathery conditions, according to the weathery conditions. Another funny example, whenever the sun is out there, people do go and do the barbecue actually. Well, when the sun is out there, we should be consuming the cooling things, not the heaty things actually, the easily digestible things, light food, not the heavy to digest food. So we need to try and understand this basic things. According to the weather conditions, we should change our diet, we should change our lifestyle as well. I mean, you are allowed to sleep into the hot day during the day for
But
15
when we say sleep, it doesn't actually mean you can sleep for hours.
Yeah.
It's, don't get misconcepted that, yeah, Ayurveda allows you to sleep.
power nap.
Yes, exactly. That's what.
So that does
is
the trick
allowed.
into the summer days, but into the winter or cold days, you are not allowed. So these are the things. Practice deep breathing, yoga, pranayam every day. This is very, very important. I mean, you can learn these breathing techniques, yoga techniques, pranayama techniques from number of platforms. You know, many people have the like YouTube, and number of things are there. So try and learn these techniques.
Just a quick with the yoga concept, because in all these things, I would like to highlight two things for sure in yoga context. One is the cobra pose, which is we call as a bhujangasana, because when we do that, it elevates your body in a way where your lungs get maximum scope to inhale the air. So it helps the lungs. Obviously, pranayam definitely is quite beneficial, but many a times people do say that we are unable to do it because we are suffering from asthma or anything else. So even pranayam, learning the technique of pranayam is a gradual process. You can't do it all in one
straight
stretch
away,
because just one set of pranayam warms your body so much that you can actually feel it, that your body is getting hot. And especially, so let's highlight a few more things. I think we are running out of time.
Yes.
So I think Abhijit, you should carry on and just.
Yeah, so guys, pretty simple recommendations. Try to relax yourself, exercise regularly, keep yourself rehydrated, and practice the meditation. See, Vishado Roganam Agram, that is the one of the principle of Ayurveda. What does that mean? Your status of the mind plays very important role in your overall health. So don't panic, don't scare, don't go into the anxiety mode, don't go into the depression mode, which plays very important role in all this what we have discussed so far. Right? So whatever happens to the body does happens to the mind. Whatever happens to the mind does happens to the body. So don't invite the negative energy. Be positive, be healthy. I hope I have tried to make it as simple as possible for you guys to understand what we wanted to convey today, which is our responsibility, as I said, and you have understood basically like in a simple way. Just to highlight, Agni and Am, this is the most important thing.
And your digestive system is the
core. Is the core. Don't forget about that. If you keep your digestive system healthy, your respiratory system is gonna be healthy. So thank you very much for coming here. And I think if there are any question answers, Ani or Raviji, over to you.
I will take on now. You can stop screen share, Dr. Abhijit and Dr. Pragati.
Sure.
Thank you so much. Thank you very presentation. Everyone can be in gallery mode or speaker view as they please. My name is Ani Kaprekar. I'm part of OMPEG, one of the founders and organizers. Both of you did brilliant. That was very informative. Even though I'm part of the organizing team, walking into this session, I was skeptical myself, about Ayurveda. But you have given some great information with a lot of examples. For myself, I know that I've been exercising and taking turmeric tablets for the last 20 years and meditating. So as far as I'm concerned, I know that I'm sorted for life. So you lost fingers crossed. But thank you very, very much. It was very informative. And you have, in short burst time, you have given a lot of information. So now for everyone else, here is what we are going to do now. We are going to run question answer session. We are now at 5:11. Until 5:20, we'll run a moderated question answer session. Many of you have been typing questions in the chat window. My colleague Ravi will pick up some questions from there. And whenever he picks up a question, he will tell me to unmute somebody. I will do that manually. And as soon as your question is asked, I'll meet you. We will do that from 5:11 now till 5:30. At 5:30, the formal session closes. But if you have free time now, and all the healthy excitement, if you want to hang around just now for more question answers, I'm sure Dr. Pragati and Dr. Abhijit are happy for giving some more time until 6 o'clock. That's what they said. So Ravi, over to you. You can let me know if you're moderating some questions. Let me know whom to unmute, and we can start our question answer session. Once again, both Pragati and Abhijit, Brilliant stuff. Thank you
Shall we
so
give the
much.
claps?
Thank you.
Thank
Ani,
you so much.
Ani, shall we give the claps?
Yeah, I'm going to unmute everyone just now, so we can give a standard Indian community and overall healthy community round of applause to everyone. Then I'll mute everyone. Give them a clap. Thank you very much.
Guys,
Thank you.
that
Excellent.
was quite a lot for us.
I'm going to thank you very much. I'm going to mute everyone except Ravi.
Ani,
Now you go. You are
Manish Patil.
Manish Patil. Hang on, I'll just unmute Manish Patil. Manish, go.
Yeah, thanks for giving the opportunity for the question. And it's really good session, really informative.
Your video is off, but that's choice.
Yeah, sure.
Thank you.
Okay, I'll just quickly start a video.
That's fine. Go on.
Okay. Yeah, so my first question
Ask your.
is how Ayurveda helps in a conditions like IBDs. And particular disease, when you talk about IBDs, like a chronic disease called Crohn's. So that is one of the first question.
Okay, that's the only question you have, right?
Yeah, also had another question in terms of the...
I says, Manish, one quick request. Let the first question be handled. There are a lot of people who have asked question. If you don't mind, then we can come to the second one. Is that all right?
Yeah, sure, yeah. That's completely fine.
Thank
Yeah.
you so much.
Thank
you.
Yeah, so IBD, basically the whole group, inflammatory bowel disease, like which includes the Crohn's, which includes the ulcerative colitis, which includes even the IBS, simply IBS. Ayurveda does a lot into that. I will explain to you, particularly with the Crohn's you have asked me. Now try and understand what the Crohn's is. The problem is, according to the allopathic medical science, the inflammation is the whole focus. Unfortunately, that's not the fact. That's where the thing is going wrong. I would like to give you the information, Manish, is like inflammation is one of the symptom of the entire pathology. So merely just by reducing the inflammation, the overall Crohn's cannot be treated. And that's why Crohn's is not completely treated or curable according to the allopathic medical science. But Ayurveda gives a lot of helping hand. How? I will explain to you. Try and understand, basically the Vata is more active in that area along with the Pitta, that means the air and fire. So what happens, the excessive Pitta starts generating over there due to so many reasons. So it can have, as I explained to you with the immunity, it can have the genetic basically mutation that can one of the causative factor, or if it's not the genetic mutation, second important cause can be your lifestyle and your diet. That can be the causative factor. So if by any chance, if this Pitta starts increasing, then the Pitta starts basically comes with the different symptoms, among which inflammation is one of the symptoms. If it increases, then obviously like bleeding we do start, and we do see a lot of bloating is there and the bleeding is there, and it can be very nasty. It can be very nasty. I mean, Crohn's does affects right from the mouth to the anal region, anywhere it can happen. But the solution is there basically into the Ayurveda, along with, I mean, I cannot give you the specific herbs because the Crohn's is very individualized conditions. Every Crohn's person, every Crohn's patient is very unique. And just to share with you, Manish, we are treating the Crohn's patients. In fact, my niece, she is a Crohn's patient, unfortunately, and we are treating her very nicely with the Ayurvedic treatment. She's just 9 years old. And we have treated more than 20 patients of the Crohn's very effectively. There are so many therapies we need to administer as well. There are so many herbs we need to take, but what we need, I will suggest to you is you can come and see us into the for the consultation in Ayurworld, because every chronic case is very unique. But the key, as I have explained to you, don't focus only the inflammation. The cause of the inflammation we need to try and find, and which is possibly not the genetic mutation, possibly is the diet and lifestyle. There the correction, and along with the herbs, management, which is possible.
Thank you, Dr. Abhijit. Ravi, can you let me know the next one? And Dr. Abhijit, before you get the next question, what I would suggest is in the chat window, one of you can give you your contact numbers and emails if you wish to. So if people wish to contact you and you're open for that, they can contact you independently. So we're not leaving anyone high and dry. Sorry, no pun intended. Ravi, can you let me know who's the next person who's
Manoj
Manoj Sangne. I'm just going to unmute Manoj. Manoj, go.
Hi. Thank you for that, Anil. Dr. Abhijit, you actually answered my question with all the information you gave, but I'll put it in a different context. So I'm a type 2 diabetic. I've got blood pressure. My dad's got the same, etc. So I know it may be individual, but from an average timeline, following your advice and obviously after seeing you in a consultation, can you put actually a timeline period of how you successfully treated somebody with my illnesses?
With the diabetes and with the hypertension. So basically
type 2 diabetes, yeah.
Type 2 diabetes, yeah. So we regularly see the type 2 diabetes patients and even the hypertensive patients. Try and understand there, as I explained to you, diabetes is not merely the sugar levels or controlling the sugar levels. It is reducing the kleda, that means that ama kind of the substance from your body, which is situated over there. And Ayurvedic herbs work fantastically into that. I have given you the home remedy already. What I will suggest to you is try and understand the blood pressure. Now, the blood pressure is nothing. It's the reactive mechanism actually, right? The blood pressure is the physiological reactive mechanism. And we need to try and understand the cause behind that. Why it happens with the diabetic people very commonly, the reason behind that is the obstruction with that kleda. And that obstruction comes in the form of when we get the blood test done, cholesterol is raised. And then effectively, the hypertension can come up. So there are fantastic herbs. There are so many things which can be used. So far, if you would like to know how many we have treated, so numbers, well, since 2009, more than 12,000 patients we have treated, among which the diabetes, I must say, thousands and thousands must be there, and including the high blood pressure as well, thousands and thousands. And simply, I will like to highlight simply using simple herbs. I mean, one example I would like to give you. I had a very old patient who was 80 years old, having the blood pressure, and he was on the 3 blood pressure tablets, and he wanted to reduce that. We found out like he is deadly constipated person, deadly constipated. We gave him Ayurvedic laxatives. I didn't use anything as an antihypertensive. His constipation got relieved and his blood pressure tablet came to 0, nil at the age of 80. So understand the cause, not the effect. You are having the damp on the wall, and what we are doing is we are painting the wall and putting a lot of things onto the wall. Go and find where the leak is, treat the leak. That's what I can explain to you, Manoj.
Thanks. Next one is Vasundhara Desai. Ani?
Vasundhara Desai. Just, yeah, I'm going to do that. Hang on. Yeah, I'm unmuting Vasundhara Desai. Go on, please.
Yes. Good afternoon, Dr. Abhijit. Myself, I'm a rheumatoid arthritis patient on allopathic medicines, methotrexate. I just had a doubt whether since we are on immunosuppressant drugs, and these are said to be immunosuppressants, so how do I protect myself? Is there something more than the normal population which I have to take care during this pandemic? That was
very good question. Beautiful question, actually, Vasundhara. And thank you very much for coming up with this question. See, this is where the thing is. Now, talking particularly about the immunosuppressants, like what is happening there is again the understanding of rheumatism. Rheumatism is happening because of the ama in your body, and that has gone into the asthi, right? If you reduce the ama, if you start reducing the ama, all of your rheumatic pathology is gonna break down, and you don't need to be onto the immunosuppressants. Now, unfortunately, you are on the immunosuppressants, which you cannot stop immediately. You need to taper that off with your doctors and your consultants' suggestion. So what I will recommend to you, simply, you can start doing one thing. You must be having the dry ginger powder at home. Take that, boil that into the water and add the castor oil in that. That's basically is going to help you a lot to initially start reducing the ama. And always you can come and consult me where I can start effectively working on your rheumatism. I have treated a lot of rheumatic patients. Best successful story I can share with you with the rheumatism is I had 8 years old beautiful girl actually, and she was suffering with the rheumatism.
And she was put on methotrexate as well.
And she was onto the same methotrexate, and their parents were so much worrying about what's going to happen with her. And we explain to them, change her diet, basically change her the way she is eating, and that has treated. She is completely cured now. She took the 3 months of the herbs with us, and she is without the methotrexate now.
And now she is perfectly fine.
Yeah,
brilliant. Ravi, next one please.
Lalit.
Yes, I'm unmuting Lalit. Lalit, go please. Lalit, you are
This is my
unmuted.
hi.
Please go. Ask your question.
Yeah, can you hear me?
Yes, yes, Lalit. Yeah.
Yeah,
We can
hi.
hear you. Please go ahead.
Yeah, sorry. This is my nickname. My real name is Robin Landge. So
Robin,
sorry about that.
fantastic. Robin Lange, fantastic. So
Yeah.
Robin, Lalit, go on.
Okay. Yeah. I just want to understand whether Ayurveda has any remedy for this hypothyroidism. So any glands related diseases whether Ayurveda can treat. So that is
Yes.
my key question. Yeah.
Sure. Again, a very nice question and beautiful question. I will tell you, see, hypothyroidism or any basically, the abnormalities into our hormonal levels, whether it is thyroid related or whether it is estrogen, progesterone related, where the infertility comes or gynecological disorder comes. Try and understand hormones, they are basically, getting released and they are getting activated with what? With the vata. So always this people who are hypothyroid, who are having estrogen or progesterone level problems, or even the diabetes, the vata is the key there. And if we try to successfully balance the vata, then this hypothyroidism is not a straightforward pathology. Just because we cannot understand the hypothyroidism in one concept only. There are so many different systems which gets involved into that. But yes, just to share with you guys, there are now Ayurveda has come to this stage. One of my friend who is practicing in Pune, he only treats the thyroid patients. He don't treat anyone else. So he is a thyroid specialist, Ayurvedic practitioner. So his clinic only treats the thyroid patients. You don't see anyone else. So it is effective. Don't worry about the thyroid patients. If you're taking the thyroxine, even that can taper off, that can come off. Ayurveda does have a brilliant solution for that. The only thing is, you need to have a little bit of the patience and you need to follow what Ayurveda says and understand the way Ayurveda looks into that.
Okay, thank you. Ravi, who's the next one, please? Thank you.
Navi or Navi, N-A-V-I.
N-A-V-I, Navi. Okay, so Navi's there. I'm going to unmute Navi.
Hello.
Navi, go please ask your question. Thank you.
Hello, good evening. Thanks to the doctors. I'll come straight to the question. I have developed a little bit of hoarseness of voice, which I was concerned because it was acute. When I was talking to someone, suddenly the hoarseness came. I consulted one of the ENT doctors who is my friend. He said it could be because of silent acid reflux. Although I don't feel any acidity in my stomach myself. Could it be the reason? Is there any remedy for this? Because I can't see the doctors personally due to COVID situation. I'm just concerned. Could it be something, something frightening or
no
something?
Problem. Sure, Navi. See, first of all, licorice is the key for you. If you have the licorice powder, licorice sticks, start chewing that. Or if you have the licorice powder, start taking that along with the honey. First thing. Second important thing, do the gargling along with the oil. You need the more and more oil if you have the hoarseness of the voice rather than the warm water salt gargling. Use the sesame oil, make it warm and start doing the gargling. That's the second thing. Third important thing is basically you can start taking the steam, lots and lots of the steam. That's going to do the trick. And if you have the cloves, basically, start chewing the cloves, which will preferably help you. But just to share with you, hoarseness of the voice can be a symptom of even the thyroid, hypothyroidism that we need to check, obviously, like you need to check with your doctors. That can be just because of the vata, like, degenerative changes into the system, which is a very specific condition. So yeah, I will like to say, try these remedies. That's going to help you. If it's not settling down with this, come and see us.
Okay, will do. Thank you very much.
Thank you. Put Navi on mute again. Thank you. Ravi, who's next? Now we still have about 2-3 minutes left. And of course, we'll just so that everyone's aware, we'll bring the formal session close at 5:30. So if anyone wants to leave, they can leave. But we still have time till 6 o'clock. The session will remain open. If you have more questions, Dr. Abhijit and Pragati have promised that they can give us some more time. However, the formal session will come to an end at 5:30 as promised. Ravi, next one, please.
Sonal Sonawani.
Sonal. I can't find any Sonal here just now.
Okay, so
any other ID they have logged in by? I don't know. I can't. If I search Sonal, I can't find the Sonal.
Dipali.
No, Dipali. Yeah, okay, I can find Dipali. Dipali, you're on unmute. Please ask your question.
Hello.
Dipali, please ask your question.
Yes, Dipali.
Thank you. We can hear you. Go on.
Yeah,
Hello, for Nastya. Can we use olive oil? Because I'm not sure about sesame oil, what we get, and ghee, because it is not done at home. So I'm not sure whether use the ready-made ghee which we get in the supermarket, or we can use olive oil.
You can use the olive oil as, yes, Dipali. So you can use the olive oil as well. That's not at the problem. You know, the overall practice is like that oilation has to be there so that the sticky mucus should not stay there. That's what the key factor is. So you can use that. The another good thing is like you can take simply the juice from the ginger, right? And you can add little bit of the jaggery in that. Good. Mix it very well, and you can use even those drops for the nasya. That does help as well.
Oh, that's good. Thank you.
No problem.
Okay.
Yes, Ravi. Can we have a last question now? Because yeah. Sorry.
Anil.
Anil. Okay. Anil. There's only one Anil. Okay. Okay, I've unmuted Anil. Probably this could be the last question for the day. Thank you. And then we will of course go informal. Anil, you are unmute now. Please go and ask your question.
Yeah, hi, thanks. Abhijit, the quick question. You know, I'm from a clinical research, and I know how allopathy they are rigorously doing the clinical research, particularly in the COVID-19 as well. I'm working on one trial. I never seen any studies happening on Ayurvedic field. I know it's because of the financial constraint on the Ayurvedic field, but I don't know. We need to promote this worldwide because it's such a nice history and we can see the results, but it's not going out of India that effectively. So can you just elaborate on that?
Hello?
Hello?
Yeah, go on. Did you get the question?
We couldn't understand
well,
fully, it just got cut off.
Okay, let me put it very simple. In the clinical research, we have seen a lot of allopathic clinical research spending millions and millions of pounds, but we haven't seen Ayurvedic clinical research. So to go out of India and to promote Ayurveda to the wider population out of India, we will have to have a scientific background, and that can come from clinical research.
Exactly.
My question is, why there are not so many clinical research happening? I mean, we are keeping it limited to ourselves, within Indian or Hindu community. So why it's not going out?
Yeah, I will explain to you. Well, very good question actually, Anil, and thanks for sharing this basically question. See, first of all, it is not limited to any community. It is not limited to any religion. It is not limited to any country. Ayurveda is for every human being, every living being, on this planet. Now, coming back to why the clinical researches are not happening. Well, that's what we are fighting, Anil, to be honest with you. I'm a active member of the Ayurvedic Practitioner Association. So we have our own association, and time to time, we have basically demanded to the government, like, we should get regulated actually. First of all, as like all the other practitioners, they are getting regulated, and all the Ayurvedic herbs, they should come into the clinical research. But unfortunately, government somewhere, they are not giving us the helping hand, and we are in a strong demand of basically, getting that done. And I completely agree with you. When the clinical research will happen, and then only basically the Ayurveda can go, widely in every country. Talking back basically in back home, Ayush, which is the Ministry of Ayurvedic Health Sciences in India, they have published a document which gives all the Ayurvedic herbs which will be effective the way we have explained to you in this COVID-19 situation, and the lifestyle regimes and some specific herbal combinations. So Ayush is helping there nowadays, with the government support. A lot of things is happening. The same we are expecting here. The government should support not only the Ayurveda. There are so many Chinese practices there, homeopathic medicines are there. So all this complementary science to come forward with the integrated approach. That means one allopathic practitioner should be there, one Ayurvedic practitioner should be there, and they should have the integrated approach and come forward and help the community. I would like to give you a simple example. In the NHS nowadays, there are so many things which are coming forward, which are having the base of the Ayurveda. I mean, a good example I can give you is the tub bath delivery. Well, that is an Ayurvedic practice, and NHS has adopted that. I mean, if you go back into the history, the lady who has started, she was the Ayurvedic practitioner. So it's a good move. So that's how Ayurveda should come into the mainstream, but we need the government's help. And Anil, you are the best guy, I can say. I mean, please guide us, if you can guide us how to come into this clinical
Mainstream.
research and mainstream, so that we can guide to other Ayurvedic practitioners.
Okay. Thank you, Dr. Abhijit. Ravi, you said you had one final question and to close, right? There's somebody namesake.
You can close now.
Yeah. One Ravi Kumar, and then we'll close. Ravi Kumar, are you there? Hang on. Of course you are there. I have to unmute my hands and mouth and yeah. Ravi, go on. Last question, and then close, please.
Thank you. Thank you. What oils are the combination of oils are good for skin application in place of moisturizers? We buy in the pharmacies here. Thank you.
Yeah, thanks. Yeah, so best I can say, universal, suitable to everyone, and most effective is the plain sesame oil. Apply the plain sesame oil all over your body, but make it warm and then apply it. And once you apply it, then let it soak onto the body for a couple of hours, and then just rinse it. Don't use any shower gel or anything. And then you can, this is the best way actually.
Of course, if you are not allergic to sesame or nuts.
Yes, yeah.
Thank you. And that we are currently going to bring the formal question and answer sessions closed. As we said that we will continue for half an hour informally. But before any of you go, who wants to go, a recording of this session will be made available in a few days, and it will be hosted on Ayurworld's website. So do see and share later. Thank you very much for joining for today's session. Again, big thank you, Dr. Abhijit Shinde and Pragati Shinde, for doing this brilliant and informative session. Sesame seed oil, last thing, brilliant. I'll suggest to wife, but she'll probably, say no. And this has been a big learning and eye-opener experience. And this session, as you know, was organized in association with the organization OMPEG, of which I'm a co-founder and core member of. Dr. Abhijit and Pragati Shinde are a member of it. If you want to know more about OMPEG, I have given contact number of Ravindra Gadgil. You can always contact. It's a body of Maharashtrian professionals and entrepreneurs. We've been active for the last 4 years. It's a membership-based organization, and our job is to promote professionals and entrepreneurs within UK. Even though it's a body of Maharashtrian professionals, that's only where our core work lies. It is open to everyone to join for cross-pollination of ideas and growth. Once again, thank you very, very much for your time. And now at 5:30, we close the event formally. Again, sort of from wherever you are, a big hand to Dr. Abhijit Shinde and Pragati Shinde.
Thank you.
And
Thank you very much.
Yeah, thank you so much. And we are going to be here for 30 minutes. And
Sure.
in OMPEG, when we finish the formal business session, we call now the PEG session begins. Sorry, doctors, but this is Diet Coke. You will say no. But yeah,
we
now
don't promote Coke. Yeah, we don't promote that many fizzy drinks.
no. I have a very scientific Ayurvedic name for this. I'll tell you later. Anyway,
Okay,
so
that's
guys,
fine
thank
then.
you very much. Have a fantastic evening. Stay safe. Stay home. Take care. And anybody who wants to ask questions now, what I'm going to do is everyone just put it in chat window, and I'll start. Thank you so much. Have a brilliant weekend. Bye bye, everyone.
Thanks. Thank you.
Those who
Thank you.
want to ask questions, hang around. Thank you.
Yeah, please ask questions. Yeah.
I'm going to just unmute everyone and see what happens. I'm unmuting everyone. एक मिनट बहुत आवाज हो रही है बहुत आवाज Ravi, what I'm going to do is I'm going to Ayurworld. I will unmute. Jay, I'm going to unmute core members. Anybody wants
come back now, working full on. So
Ravi. Yeah, anybody wants to ask questions, just put it in chat window. I'll unmute you. Who's that? Robin stroke Lalit stroke yeah, hang on.
Yeah. Just
go on.
Yeah, just one question on mainly, I do personally believe in Ayurveda and its treatment. Just only one question is there are a lot of products in the market which is commercially produced, and I was always wondering, how come, how do we believe that these products are, has the ingredients, right ingredients, because if it is produced on a commercial, scale. So I was always doubting on, I mean, not doubting, basically, I was having a doubt on how do we believe and which products to believe. There are Ramdev Baba and so many different products in the market. And I'm unsure about, how do we use them and what to use them.
Yeah. See, Robin, how it is. I mean, that's the problem area. What is happening nowadays is like Ayurveda has come as a unfortunately, rather than what you can say seva or as a service, it is nowadays has become business for some people, and they are doing purely business. Well, Ayurveda is should not be like that. Not talking about which products are useful and which not. First of all, try and understand Ayurveda is a very, very unique medical science and very individualized medical science. It's very individualized. It cannot be basically made like universal to everyone. Like, for example, Ayurvedic medicine for headache. Well, there is no Ayurvedic medicine for headache. Okay, because as I'm saying, everyone's constitution is different, cause is different, pathology is different. Based on that, Ayurvedic physician decides what will be useful. It's like that. So I have a lot of clients coming up and saying, oh, I'm taking this pharmacies, this medicine, and nothing is happening. Well, it will be like that. The reason behind that is that particular formula is not helping you because that formula has not understood the pathology in you, right? So that needs to be understood. Now, I'm not saying every pharmacy is like that. I can name the pharmacies which are doing the brilliant jobs, and I'm very proud to name these pharmacies. Dudh Papeshwar is the one of the pharmacy working since 125 years, Robin, and their products are very good, and they are doing the authentic products. When I say authentic, that means which are straight from the Ayurvedic text, basic text of the Charak Samhita and Ashtang Hruday. So people, as a layman, I will suggest to you, always buy the products which you want to buy from the basic text. Try and see the reference. What is the reference of that formula? It's not like one Ayurvedic doctor like me, Dr. Abhijit is coming. I will come in the market tomorrow and I will say, this is my formula for psoriasis. Don't believe me. If that is having the basic text reference, buy that. So there are good pharmacies, Charak Pharmaceutical Company is there. Then CKKM is there in Kerala. Nagarjun Pharmaceutical Company. They are doing generation to generation. 200 years of history is there for this Nagarjun Pharmaceutical Company. They are doing brilliant job, and they don't chase this market actually.
There's a geography related question. So I'm just going to unmute Ravi Kumar. Ravi Kumar from Manchester.
Yeah.
My city, so I have to give some representation to North.
I was just picking up that question actually.
Because see, your picture of body was both North, South, top, up, isn't it? So now North. Ravi Kumar, come on, bat for North.
Yeah. Thank you.
Go on, Ravi.
Are there any Vaidyas in Manchester, part of your network, you recommend, or do you come here and then consult? Or do we do online consultation? What's the best way for people in the north, outside of Hounslow or London to consult with you?
Sure. So we have a lot of clients, Ravi, all over the world, to be honest with you. We have the clients in Dubai, we have the clients in France, Germany, we have the clients in US as well. So what we do is we do the online consultations for them. And unfortunately, we are not able to do the Nadi Pariksha, which is like the pulse diagnosis method for them. But there are the other ways to understand that. So you can always contact us. We can do the video consultation for you. And then we can supply you whatever the herbs are needed. And to some conditions, certain conditions, we like to see some clients one-to-one. So sometimes we invite them, we call them just for the one visit so that we can see physically, we can check the Nadi, and then the rest can be done accordingly. Talking about Manchester, not in my knowledge from our organization or from our circle, anyone is there. But if there is anyone, I will definitely refer to you so that it will be more convenient for you, and it will be easy for you for the follow-ups and everything as well. I will definitely look into that.
Thank you. So anyone else here wants to, Doctor, we can also, whenever the world comes to some kind of new normal and we start moving, not just electronically, but also by atoms, maybe we'll do some session in Manchester. I'm sure Ravi must have, it will be useful, like on a different forum.
Sure.
Thank you.
Sure.
Anyone else wants to ask a question? And now I think you can unmute yourself, but sorry?
Ashwini?
Ashwini, let me just look for Ashwini. No, Ashwini, I can't see any Ashwini.
Okay, then Svena.
Svena is also not there.
Okay.
Who else? If there are no further questions coming, just see if you missed any questions, give a shout out. See, whenever the sign of session going good is after the formal session finishes is 5:30, 30 people are still hanging out. That means Dr. Pragati and Abhijit, you know that your session has gone really well.
Thank you.
It's a very Indian way of complimenting, that you have, as if my feet are not moving from the place.
Yeah.
Okay, who else wants to ask a question? Ravi, come on, let me know.
Yeah, can you see Monita is there?
Anybody here? Is Milind there?
Maybe I
Milind
can ask
Kandle
quickly.
Milind is gone. Yeah, who's that?
Monita?
Hi.
I have a question regarding another.
Yes, Ravi. Yeah.
Who's that? Go on. Who wants to ask a question? See, people are messaging me in private chat. Please put it in open chat. If you message me privately, it's difficult because it opens.
Yeah.
Prabhakar Patankar.
Prabhakar, yeah. Can you unmute?
Yeah, I'll do that. Yeah, Prabhakar Patankar, please go ask your question.
Hi.
Hello,
Can you hear me?
Yes.
Hi
Yes,
there.
Prabhakar.
Hi. It was indeed a wonderful session, very insightful, and it's one of the best sessions I've ever heard about all this Ayurveda stuff. One question I think somebody had asked on the chat board as well. It was about almonds, soaked almonds. Should they be peeled or not peeled? And should they be soaked overnight?
Yes, absolutely. Yeah. So we should have specified that. Very good point. They should be soaked overnight. If you peel them, that's better. That's much better. So always peel them and then consume it. That's more effective actually. Very good point actually. So
I'm going
soak them and peel them and then use them.
Right. I've got one more question.
Sorry, can I just ask this one guy, Manish Patil, who's been by mistake messaging me privately. So I'll take his question and then come back to you. Is that okay?
That's fine.
Thank you so much. So everyone gets it. Yeah, Manish, go on. Manish, please ask your question. You've been messaging me privately by mistake. Manish, you're on unmute. Please go ask your question.
Okay. Yeah. Sorry.
Yeah, there you go.
Yeah. Thanks. It was by mistake sent to you earlier.
Go on.
Okay, sure. My question is that, which is again regarding another immunosuppressant called as tablets called azithromycin, which is
azithromycin,
yeah, for the Crohn patient. Can we completely get rid of this? I know it's individual cases and we can pretty much get rid of the Crohn's. Yeah.
So yes, I will explain to you. So possibility is there. Basically, so what happens is any immunosuppressants or any steroids. Problem with the immunosuppressant and steroids is the body is dependent on that. So much dependent on that, like a little bit dose, if that goes here and there, that can be the problem. Particularly talking about the steroids. Azithromycin, methotrexate, these are all basically the different varieties of immunosuppressants. But yes, talking about the azithromycin way as well, we have dealt the patients who were onto the azithromycin actually, and we got successfully tapered that off. All right. And yeah, I'll give you a simple example, Manish. We do use, I'm very happy to share the herbs as well. Bleeding, if we have the bleeding condition of the Crohn's and someone is onto the azithromycin, like if they are bleeding, if you take the churan, like the herbal combination called Pushanuk churan, now that is a very Ayurvedic typical combination, along with what? Along with the rice water. So boil the rice and water which comes on top of that. So take that rice water off and consume this Pushanuk churan along with that. This Crohn's related bleeding, even if it's like the ulcerative colitis related bleeding, that can stop straight away. That's what we do for our Crohn's clients. So this is one of the example, of course, but cutting down the pathology, as I explained to you, Pitta and Vata, that needs to be balanced. The cause needs to be treated, and that is possible. Another example I would like to give you, another of my patient, he was having the stress related the Crohn's actually. I mean, stress was the basic cause. So what we did in that patient is we started doing the Shirodhara, that means the oil flow on the forehead, which is the key treatment to calm down the mind, relax the mind. And any pathologies which are related with the mind and the effect of that onto the body, which is like Crohn's, which is like ulcerative colitis, which is like irritable bowel syndrome, which is like eczema, we don't need to work onto the effect, work onto the mind with the Shirodhara, and then basically it can be treated. And what we have used into the Shirodhara, you will be mesmerized to know we have simply used a simple medicated buttermilk. We have brought the yogurt, we have like processed that with the Ayurvedic herbs, and we maintained the flow of the buttermilk, and that patient had a tremendous effect, like very good results onto the Crohn's condition. So if once you understand the pathology, treatment is very simple.
Okay. Thank you. Now I have two people in queue. So one is Prabhakar, whom I had pushed back earlier. So first I'll unmute Monita. Monita, ask your question and then we go back to Prabhakar Patankar. Okay, that's the sequence. Go on, Monita.
So, Monita here. Hi, I'm joining from Mumbai. My question to doctors is, I have an aesthetic question actually. After you drink the turmeric milk, after heating it, your teeth get yellow and they are a little awkwarding. So does Ayurveda have anything which as an antidote to get that back white, your teeth white?
Yes, yeah. So Monita, there are the two churnans. I will give the names of that. Write it down. One is called as the Pitaka Churan. Pitak Churan. Just because you are in Mumbai, you can find it very easily. Or the another one is called as the Kalak Churan. So if you can buy these churans and if you start, like rubbing them on your teeth, they're gonna help you. If you can't find that, simply I will explain to you. You will easily get the Triphala Churan, Triphala powder. If you start rubbing the Triphala powder on your teeth, they are the brilliant on the not only the teeth but for the gums as well. So they increase the holding capacity of the gums very brilliantly. Bleeding gums can be treated very nicely, and whitening of the teeth that can be achieved very nicely just by rubbing the Triphala powder.
Brilliant. Now I'll go back to Prabhakar Patankar. Prabhakar, go on.
Yeah, I hope you can see me better now. This was about the dates and the ghee. So does it need to be the khari, the dry date, or is it just a normal khajur that we get in the market? Is that okay? Or has it got to be the kharik, which is a very drier version of date?
Now, in this, you can use both of the things. The dates get soaked quicker and the essence of it comes quicker. But if you take the kharik, you just have to kind of probably wait for a bit longer till the kharik actually softens. And that is why we emphasized more on the dates. Obviously, kharik is more beneficial, but I know people don't want to kind of get that much, they don't want to take that much effort. So I've given it to the dates, honestly speaking.
No, that's useful. Thank you.
Fantastic. I'll go put you on mute again. Ravi, are there any people in the queue or messaging? I have not received any message. Otherwise,
no, not in the queue.
Okay. So I think anybody who wanted to ask question, I think we have
Anuradha has some comments. Yeah. Can you?
Is there a question or a comment?
A comment, some complimentary comment. Yeah.
I'll unmute if there's a question. Okay. Yeah. I'm unmuted.
Anuradha. In case if we have missed any.
Anuradha, you are.
Yeah, go on. Anuradha, you are on unmute now. I've unmuted. Can't.
No, I think she can't.
Ravi, I have unmuted Anuradha, but there's no response. Again, anyone else? Yeah, I just saw you coming on the screen. Do you have a question?
Yeah, Ani, my question is to doctor that have you started or regularly doing video consultation?
We are in fact currently doing it since we have closed down from the 21st of March. All our video and online consultations, our telephone lines are still on for people.
Okay, so in that case, if somebody has to, is it that person has to go and see you in person? That is a must, or you can still continue on?
No, we can still continue.
But just in case, if we really feel we need to see you in person, we will let you know, and we will wait for the right time to come in this scenario, and then we will arrange to see you in the clinic. But till then, we can definitely go ahead for the online consultations.
And the herbs can be started as well.
Yeah, because we are doing the supplying the herbs. We are posting the herbs if required to the clients once in a week.
Okay.
Ani, Deepali.
Yeah, I'm unmuting Deepali, I think. Yeah, that's fine. I think, yeah. And Deepali, unmute, please ask question.
Yeah, hi.
Everyone else, just one second. Deepali is asking question. My kind request to everyone else who's here in the hang-around space, please go on mute. So Deepali can be heard correctly and Dr. Shinde can be heard correctly. So everyone else, please go on mute except Deepali, Dr. Shinde, and Ravi and me. Thank you.
Yeah, it is Nayan. Yeah, it's Deepali's husband. Yeah. So
Okay,
I just want to know, is there any home remedy, doctor, to lower the blood pressure?
Yeah. Now, again, depending on the cause, I didn't catch your name, sorry, but depending on the cause, now I will explain to you, if your blood pressure is because of the cholesterol, so home remedy for that is start using the garlic, lots of garlic in your diet, or you can start eating the garlic cloves. Sometimes garlic becomes very hot in some patients or some people, if they are pitta prakriti, like, naturally they have the heat in their body. So solution for that is soak the garlic, make the one slice into the garlic clove and soak that into the buttermilk for overnight so that excessive heat gets out from the garlic and only anti-cholesterol effect can be used for the garlic. So if your high blood pressure is just because of that can be used. If your high blood pressure is just because of the digestive system related, like I explained to regarding one of the client, that needs to be treated. So there can be the home remedy. Like we have seen many patients with the constipation and high blood pressure.
Exactly.
So you can use simply the castor oil, and relieve your constipation. That's going to eventually help to your blood pressure. Some people, they have the blood pressure as a secondary to some pathologies like diabetes and diabetes and high blood pressure, or it's the any hereditary or stress related. So if the stress related is there, then for the stress, I can tell you, like, applying the oil, coconut oil onto the head, doing the massage onto the head and doing the massage onto the feet, rubbing lots of oil onto the feet before going to sleep. That does helps a lot. So depends actually
what the etiology, like what the causative factors are. That's what the beauty of Ayurveda is, basically.
Okay. Thanks, doctor. I think you explained it very well. Looks like it is more of cholesterol and stress. Yeah.
Thank you. I have one question next from Tajinder Rai.
Yes.
Tajinder, you are unmuted now. Please go ahead. Ask question.
Hello. Thank you very much. I just had a question about earaches, please. A couple of people in my family, including myself, have had an earache. We did hear from somebody that if you leave a clove of garlic within sesame oil and let it completely burn out and then use that oil in your ear, that should help. But it's helped somewhat, but it hasn't really cleared the full cause.
I'll explain to you, Tajinder. See, earache, basically, again, cause needs to be found out, but the common cause is always the vata, the air increases in our body. I have talked about the vata during the session. Vata is of 5 different types: pran, udan, vyan, saman, and apan. And the location of one of the important location of the air is the ear. It is the ear. So what happens is the chain of ossicle, which we have inside our inner ear, that starts getting the degenerative changes and a lot of dryness comes over there. So if you start putting the oil, that's going to help. So the oil which you did explain, you can give it to go with that, no problem. But I will give you the name of one of the particular oil which will be more useful and which has helped for many of the clients. That is called as the Anutailam. Anutailam is very useful for this kind of the earache. If someone is having the tinnitus and the earache, like tinnitus means the sounds are coming and the earache is happening. If that condition is there, they need some internal herbs particularly, and then basically, the oilation. But Karnapuran, the way we can put the oils into the nose, we can put the oils into the ear as well. So you can use that. Make sure you are always putting the warm oil. That's more important thing.
Thanks very much.
Thank you.
Okay, I have one. Thank you. I have one question from Hemash Shah. I think that should be probably the last question, and then we'll close now because it's getting to 6 o'clock. Yeah, thank you. Yes, Hema, go on. Hema, I've unmuted you. Ask your question.
Hi, Pragati and Abhijit. Thank you for a session. It's wonderful. I just had a quick question. I just heard you mentioning that castor oil can be taken because I've got borderline blood pressure now. So now I have constipation problems. So I've been taking Haritaki Churna. So the question was, which one is preferable, the Haritaki or the castor oil in the long run, and how long can we take it for?
Yeah, so if you are fine with the Haritaki in terms of opening the bowels very nicely and comfortably every day morning, then continue with the Haritaki. No doubt about that. castor oil, the benefit of the castor oil is only try and understand it is into the oil form actually. So oil is always preferable compared to the haritaki, which is like, into the powder form.
Yes.
So yeah, but if you're fine with the haritaki, if your constipation is not the problem, along with the haritaki, continue with that. Don't change that onto the castor oil.
And is it okay to carry on long term?
Yes,
Of course,
yes. Haritaki you can.
Yes,
Definitely.
haritaki is rasayan. It is a rejuvenating factor. The more and more haritaki you're gonna eat, the more you're gonna live. Believe me.
Brilliant. Okay. Thank you.
Hema, you got the message, yeah?
Yes, I did. Yes, Pragati.
So
everyone here, Pragati is a lifesaver for me. She's really helped me with a lot of conditions. So absolutely brilliant, doctor.
Brilliant to know. Thank you, Emma. Dr. Abhijit, now I did say last question, but there is one namesake of yours, Abhijit. I think it's Abhijit Pawar. That's the last question I'm going to take, and then we'll close the session because I'm running this from home, and in the interest of otherwise my wife will get angry and Ayurveda can't do anything because I'm
No, we can't
I'll have to
interfere.
close it. Thanks. So last one, Abhijit Pawar, please go ahead, and then we'll close the session. Come on, Abhijit. Abhijit, go ask your question.
Hi there. Good afternoon. Thanks for a very informative session. My question is, I have managed to lose about 4 to 5 kilos over the past 2 months. But what I've noticed is my blood sugar levels have gone up. And I'm a type 2 diabetic with a full dose of metformin and a combination of sitagliptin.
Go on, Abhijit. Did you get the question?
Yeah. So basically, he has managed to reduce weight, but at the same
Same
time,
time,
his sugar levels have gone up.
Yeah.
So somewhere the meda is.
Yeah. So I will explain to you. See, Abhijit, what happens is, any abrupt change to the system, any abrupt change to our health, that can create the problem. Now, what has happened from the Ayurvedic point of view in your system, I will explain. When the weight gets lost, what gets lost is the meda, actually the fat. Among that, if you remember that slide I explained to you, 7 channels are there. So the meda, that has got basically reduced. All right, but along with reducing the meda, the kleda was not reduced. Okay, which is the most important thing for the pathology of the diabetes. So unfortunately, the meda, that means the mass, was reduced, but that kleda, that clay kind of the thing, that mucousy thing, that's not reduced into the system. And that thing was coping up very good with that mass which was present. And abruptly the mass was gone, but the kleda is still there. And that's why that kleda came in the form of the increased blood sugar levels, or increased urine, or increased basically, like the thirst and the pathology of the diabetes. That's why it has taken place. You are not only the one, Abhijit. We have seen the patients like you, similar patients. And we always recommend, if you want to lose the weight, definitely do that. It is very important to do that, but gradual is very important, because all of a sudden body cannot cope up. I mean, I just want to share, I'm not scaring you. One of my patients, he lost the 30 kgs in 1 month. Unfortunately, he had the heart attack at the age of 42, and he died. He died. So,
and you say that first by not scaring you.
No, I'm not scaring you, but I'm telling you the impact of
how important it is to understand, to kind of bring in the balance
gradually,
and the gradual process of everything
is very important. Yeah. So I mean, congratulations to you. You have achieved that, which is impossible. Losing that much is.
Yes, thanks to my missus. My missus is actually a GP as well, and they mentioned that there is a healthy way of losing weight, not more than 2 to 2.5 kilos max a month. Or else then your body doesn't understand it.
Yes, exactly.
All right. So I think that's about it. Thank you very much. We have come to 6 o'clock, and now it's time to, you've spoken a lot about arm today. So coming to time to go from Diwane Arm to Diwane Khas, which means kitchen, to get cooking. So thank you everyone for joining the session, and goodbye and have a wonderful evening, and stay home, stay safe, and bye-bye from OMPEG, bye-bye from Ayurworld, take care. And I would just request Ravi and Dr. Shinde to hang around. Everyone, please, now you can log off. Thank you so much. Bye-bye.
Thank you very much, OMPEG. Thank you very much, all of you, and thank you very much.
Pleasure. Bye-bye.
Thank you.
Thanks. Bye.
Take care. Bye-bye.
फोन बंद करा था